In America's complex healthcare landscape, millions of individuals who purchase their own insurance are facing a financial storm. The cost of maintaining coverage through the Affordable Care Act is poised to become significantly more expensive. This is the story of what's happening, why it's happening, and who will be hit the hardest. For the past several years, the ACA marketplace has been relatively stable. Thanks to increased government assistance, enrollment has soared. In Texas alone, nearly 4 million people signed up for a 2025 plan, a number that has tripled since 2020. This stability, however, is on the verge of a dramatic reversal. Insurance companies across the country are now requesting the largest premium increases since 2018. Nationally, the median proposed rate hike for 2026 is 18%, with some insurers seeking increases of 40% or even 65% for certain plans. In Texas, the average proposed increase is 24%. In New York, one insurer has proposed a 66.4% rise, and in Washington, the average request is over 21%. These are just proposals, and state regulators may negotiate them down, but they signal a massive shift in the cost of health coverage. So what is causing this sudden spike? It's a perfect storm of factors, but the main driver is the scheduled expiration of enhanced financial aid at the end of 2025. Let's break that down. During the COVID-19 pandemic, the federal government increased the financial assistance, known as premium tax credits, that helps people afford ACA plans. This was done through laws like the American Rescue Plan Act and the Inflation Reduction Act. This extra help lowered monthly payments and made more people eligible for assistance, including those with higher incomes who previously didn't qualify. With this assistance, ACA enrollment reached a record 24.2 million people in 2025. But this enhanced assistance is set to end. Unless Congress acts to extend it, millions of people will see the amount they personally pay for their premiums skyrocket. On average, out-of-pocket premium payments for those receiving subsidies are expected to jump by more than 75%. For example, one analysis showed a 60-year-old couple in a rural Washington county could see their monthly premium leap from around $581 to over $1,800. This leads to the second major problem, a sicker insurance pool. Insurers are betting that when prices jump, many younger, healthier people will decide they can no longer afford coverage and will drop their plans. This leaves a smaller group of enrollees who are, on average, older, sicker, and more expensive to insure. To cover the higher medical costs of this remaining group, insurers raise premiums for everyone. This factor alone is estimated to be driving rates about 4 percentage points higher than they otherwise would be. On top of these issues are the consistent underlying pressures of rising healthcare costs. Insurers point to the increasing price and use of expensive prescription drugs, such as new weight loss medications, higher labor costs for doctors and nurses, and general inflation. New tariffs on imported medical supplies are also expected to add to the financial pressure. The impact of these changes will not be felt equally. The loss of subsidies will hit lower-income individuals and families the hardest. Older adults and small business owners who gained eligibility for assistance under the expanded rules will lose that help. And people in rural areas, who often have fewer choices for insurers, are also expected to be severely affected. The consequences could be far-reaching. The Congressional Budget Office projects that the expiration of these tax credits will lead to a significant rise in the number of uninsured Americans. Estimates suggest about 4.2 million people could lose their coverage. This threatens to undo years of progress in reducing the uninsured rate, which reached an all-time low in 2023. Experts worry this could send the ACA marketplace back to the instability seen in 2016 and 2018, with fewer insurers competing for customers, leading to even higher prices and fewer choices. The window for a solution is closing. While Congress could vote to extend the enhanced tax credits, insurance rates for 2026 are being finalized in the late summer for an open enrollment period that begins on November 1st. For now, millions of Americans are bracing for sticker shock and the difficult choice of paying significantly more for health insurance, finding a cheaper but less comprehensive plan, or going without coverage altogether.